continent and globally have been able to say we are here. But let me state it as well. You know, we have 200 people working, just 200 people, having to do with 63 million people in our country, you know, and 9 provinces, 9 provincial managers with at least less than 10 people working in the offices. And we have been working, and I want to say thank you to human rights staff members in the PMs, the provincial managers, and also all the staff members having to deal, and at head office having to deal with all the issues that we're doing. And so I want to say thank you to Martin and your team for producing these reports, and also to acting head of legal service, Ms. Mbeki, the program director. Thank you. I hand over to you.
Thank you so much. Thank you so much to the chairperson. I will then be, we are going to go straight to the gist of today. We will begin with a presentation by Martin, Dr. Sahrc. Please go ahead, Martin.
Good afternoon once again, and thank you so much for the kind words, and we welcome everyone who is here and also those online. I will just give I'll just give a brief overview of the report itself on the state of human rights in the country. But before we go to that, it is important to acknowledge a number of people who played important roles in all the reports. Of course, our commissioners who are indicated before, and then members of staff who are in the provinces and at the head office, and then, of course, also the others who support them, and then members of the research unit. The other thing one should indicate that writing these reports is very, a very taxing process, but we're there now. And what one asks is, we hope that you take time, read them, and we welcome any criticism, because we hope to grow from that. So my colleagues will talk to the different reports as the program indicated. Now, going to the issues of the report itself, in terms of how I've presented it and how you see it, first of all, I'll give a brief background about the report. Second, I'll talk about the protection mandate and the work that was done there. And then the third is the monitoring of human rights that was done. And then the advocacy and promotions work that was done. In terms of the background, this is the first time that the Commission writes and produces a State of Human Rights report in the current form, in the novel form in which we've done. And this report and the other reports are based on the work that the Commissioner has done. All the many people that you've had, less than 200 people, and it is not based on information that we have gathered from other sources, but things that we have experienced, and we hope that it can be then used as sources for others to actually see what it is that we've picked up. So we identify also key human rights issues that we have picked up in the work that we have done in the 24-25 financial year. Now, coming to the work that we've done, just in a way of explaining to you what we did, we received 2,352 complaints in the financial year 24-25, But the Commission resolved complaints amounting to 7,516 complaints. We also had to take 125 initiatives as the Commission, and were also involved in 21 litigious matters. That is the protection mandate of the Commission. That's the work that was done there. Then, in terms of monitoring throughout the country, we monitored 1,394 facilities. That's covering roughly about 15 monitoring areas. And then the last issue was that we carried out 1,080 activities in terms of advocacy and promotion. And one can say that it's very difficult to find another entity that will have done that kind of work. But we can say, of course, it's because we've got a footprint across the whole country. And so the information that we produce is non-doctored, and we produce it for others to use it as they plan and also contribute to human rights. Now, in terms of the reported human rights violations, in terms of categories, the highest number of complaints was in the area of socio-economic rights, economic social rights. Sometimes we refer to them as that. The areas relating to healthcare, food, water, and social security. Then the second one was just administrative action, and you will see that as we go down the line. And then we had equality, and we had education and labor relations. Then in terms of equality complaints, we had the highest complaints of race-related matters, racism, and we had the highest complaints in terms of complaints that we had. And then disability was the second, and the others, as you can see on the graph before you. We had a number of complaints in those areas. And then in terms of respondents, the public respondents, the highest complaints were against the Department of Home Affairs, the highest respondent. And that is for issues such as, people having issues with their identification, because all of us are affected. If there's one government department that one can say affects all of us, it is Home Affairs, because it affects you when you're born, during your life, and also when you die. Home Affairs is involved in that. So there are a number of issues that were raised by people regarding identification and not getting certificates that they were supposed to get on, and that kind of thing. And then the second respondent in terms of complaints against was the Department of Basic Education. And then the South African Police Service was the third, and we had then the Department of Health fourth, and last, the Department of Social Development. Then in terms of municipalities, the highest number of complaints were against the eThekwini municipality, and then Rustenburg, and then Polokwane, Cape Town, and Victor Kanye and Joel Khabi district municipalities. Those were the 5 top respondents in terms of municipalities. And the last 2, they are both there. The graph shows 6, but I'm talking only of 5 because the last 2 are tied. And then in terms of private respondents, the highest number of complaints were against Anglo-American Platinum, followed by ESCOM, and then Legal Aid South Africa, and then Ronaldo Gauss, who was a member of parliament, as you remember, and then landlords in general. In terms of age, I will only mention 3. The highest number of complainants were between the ages of 41 and 50 years old. The lowest number of complainants were people between up to the age of 17. And the reason for this is they may complain through adults who may be their guardians or parents. And we think that that low number, that may explain it. And then, of course, people over 80, we also had very few complaints from that. Then in terms of race, the highest complainants before the commission, 79%, were people who described themselves as African or black people. Because when you complain at the commission, you have to, you don't have to, but the request for information covers these areas. And people can identify themselves, or they can choose not to identify themselves. But 79% of complainants were black people. The second group at 11% was white complainants, and then the third group was colored complainants. Then in terms of sex, the highest complainants were male, 66%, and then female, 34% complainants. And of course, some of these issues may also do with economics, ability to access our facilities and all that. And then where were the complainants located? 65% of complainants are located in peri-urban areas, meaning areas outside urban areas, suburbia, and informal settlements, and these kind of places outside the urban center. Then in terms of the urban center, we had complainants amounting to 35%. And then rural areas, which is a disconcerting issue, of course, for us as the commission, we only had 0.2% complainants from rural areas. And again, issues of economics and where we can reach at the commission come into play here. And then the information that I'm displaying there indicates roughly the areas that the commission monitored, which range from school infrastructure up to recommendations monitoring of the commission. In terms of national monitoring, the graph that is before you indicates the amount of monitoring that each province did, and also, of course, the support from the national office. And you can see that the province that did the highest number of monitoring is Northwest. And of course, the lowest is the national office. And because the national office plays a supportive role for the provinces to do their work. And the information before you there indicates the advocacy and promotions activities that the commission did, totaling to 3,180 that I mentioned earlier. And against the commissioners program, which is the program where all our commissioners operate from, you can see it indicates 0 on visibility and awareness. The reason for that is because commissioners don't actually implement on their own. They support all the provinces that you can see there and the advocacy and communications unit. So that's why there's a 0 against that. And then I'll quickly go through the issues that we identified in the report, which are the pressing human rights issues based on the work that we did. The first one is the failure by the state and private individuals or parties to observe human rights of persons who are alleged to be in conflict with the law. This can be, for example, you remember the case of Stilfontein, the mining issues that happened there, which affected the right to life and access to food in that case. And then you also, I think, remember the case of the Zanzu Bar and Lounge in Pretoria. And then the second issue which we picked up through our work was the issue of inadequate provision of basic services. And most evident is in the area of health care access and also water. And as you saw earlier, these issues are one of the most complained issues that the Commission receives, if you recall the earlier display that I put up. And of course, water is key to human rights, and there have been a number of issues that we picked up in water-related issues, such as recovering of costs that related to, supplying water, and then the varying levels that we see because of loss of water through aging infrastructure. Then the other issue was that racism remains rife, and you recall that we had a number of high-profile incidents where we had private individuals, for example, involved in propagating racism. Then xenophobia also is an issue that we picked up, and this is through disinformation and misinformation, which persists, and there are issues, for example, such as the food poison occurrences, and then the Stilfontein matters that I alluded to earlier, and then utterances by some public figures during elections, around elections. Local government was another issue, and you saw that the highest number of complaints were in KwaZulu-Natal, Limpopo, and Rustenburg. Limpopo and Northwest, sorry for that. And then the other issue that we picked up is climate change and its impact on human rights. And there we again saw that because of flooding, areas in KwaZulu-Natal, Eastern Cape, and Limpopo were affecting the right to life and issues such as housing. And then another issue is the enforcement of petty offenses in major cities. For example, Cape Town, Johannesburg, and Durban have bylaws that criminalize, petty offenses. And petty offenses are, if I can say, offenses that really criminalize poverty. So you find that people who are, marginalized in terms of, socio-economically are the ones who are most affected. Then the other issue that we picked up during the election monitoring was the issue of inclusion of persons with disabilities and older persons adequately in election processes. And the Commission released a report following the elections, and we shared that with the IEC, hoping that in the future, issues arising out of that will be addressed. And then another issue which we thought is very important for us to highlight, which can have a negative impact on human rights many years down the line, is the issue of bullying in schools. According to our information, 68% of complaints received from schools relate with bullying. And so if we have to address human rights, I think that's a place where we have to start, for example. And then there was an issue around load shedding and power cuts, which affected 51% of health facilities have backup systems. 49% don't have. And then 30% of schools do not have access to backup power systems. That then means that when there's load shedding or power cuts, these rights are then affected. And then lastly, and I mentioned this earlier, the Commission also picked up that we only receive 0.2% complaints as the Commission. And of course, one alluded to the issue that it may be because, of course, our location and other factors such as people not affording. Thank you so much.
Good. Thank you so much, Dr. Nsibira. As we said, that we'll have the Q&A after, apologies, after all of the presentations have been done. We'll ask Ms. Olga Mahori to do her presentation, please.
Thank you, Program Director. I would like to greet our chairperson, the chairperson of the commission, Commissioner Madingo's present, and all commissioners who have joined online, Honorable Minister, and all protocol observed. So my name is Olga Maori. I'm a researcher for ESR, and I'll be presenting on Section 184.3 report for 2024-2025.
So, just wait. What is the problem?
So it is that you want to move from my mind.
Okay.
I think it's going to be better like that. Thank you. Thank you. I'm back online. So the overall content is the background, how we secured information, the key findings for the right to adequate housing, the right to health care, the right to water, the right to social security, the right to education, the right to environment, the right to food, and then we'll also highlight the recommendations and conclusions. Moving on, the background. What is Section 184.3? So each year, the Human Rights Commission must require relevant organ of state to provide the Commission with the information on measures they have taken toward the realization of the right in the Bill of Rights concerning housing, health care, food, water, social security, education, and the environment. Sahrc has prepared a Section 184.3 after 10 years of hiatus. Like, it's been 10 years. So, and then a decision taken to not prepare a report was due to lack of cooperation from state to supply information, a shortage of human resources, approaching matters differently, e.g. like producing policy briefs. And then we don't have a constitutional or legal requirement that Section 184.3 report be prepared. Failure or inadequate cooperation by organ of state can be seen also in this current report. Insufficient human resources necessitated collaboration with the Free State Center for Human Rights, University of the Free State. So for this section, I'm the only one dealing with this section. A report is meant to identify successes or systematic failures by organ of state in realizing certain socio-economic rights, which I mentioned. The processes followed to secure the information. Sahrc prepared a comprehensive questionnaire on each of the identified, the 7 rights mentioned. Questionnaire and covering letter was sent to Directors General of relevant government departments, in this case, 7 departments mandated for all these 7 rights. And then deadline was provided for responses to questionnaire because also wanted to analyze and prepare the report. In some cases, there was an interaction between government, department, and Sahrc to clarify matters in questionnaire, like a few stakeholder engagement were held. Adherence to deadline was extended in most cases. Response rate was good, as 5 out of 7 rights analyzed based on information provided. So the key findings for the right to adequate housing. Number 1 was delay in project rollout and underutilization of funds and budget rollover. The Department of Human Settlement Strategic Plan 2020-2025 commits to sustainable and integrated human settlement. However, funding inefficiencies hinder the progress. The persistent underutilization of allocated housing funds remain one of the biggest obstacles. And then number 2 is misalignment between budget and housing demand. The distribution of funding does not align with actual housing needs. Urban areas such as Johannesburg, Cape Town, and Durban have the highest demand for housing, yet funding mechanism remain inflexible, favoring rural and low-density development over high-density urban solutions. The misalignment are forcing low-income families to settle in informal settlement or overcrowded backyard rentals. So another finding was lack of structured finance for the gap market, lack of financial assistance for the gap market. In this case, we mean the household earning between 3.5 to 22,000 per month. And these households cannot qualify fully for the subsidized RDP houses, and then cannot secure private mortgage loans as well. So number 4 is housing backlog and informal settlement. According to DHS, housing backlog for the year 2023-2024 reporting period is 3.34 million households, and only 42,771 units were delivered in the said reporting period, 2023-2024. The discrepancy, demand and supply, perpetuate informal settlement is 1.27 million households. Number 5 is new legislation, policies or programs. We acknowledge that they do have new legislation and policies and proposal that represent reasonable measures to achieve the progressive realization of the right to adequate housing. But there's no clear implementation plans. So we're moving on to the second right in section 184.3, which is the healthcare. So the finding was lack of financial resources. Limited financial resources impacted healthcare services, service delivery, funding shortfalls in essential areas such as oncology care and emergency medical services. Inadequate funding affect procurement made for medical supplies, infrastructure maintenance, staffing, low healthcare quality. Shortage of doctors and nurses in rural areas increase patient waiting time and reducing services effectiveness. Many hospitals and clinics are in poor condition, lacking essential utilities such as clean water, electricity backup, and emergency transport services. We're moving on to the third one, which is right to water. So lack of access to sufficient water and decent sanitation. People in rural areas and people in informal settlements continue to lack access to clean water and decent sanitation. Frequent water supply disruption and sewage spillages. We can even, we're also experiencing that here in Gauteng. We have frequent water supply cut disruption. So backlog in infrastructure maintenance as well. And then we're moving on to social security. So the key findings here were the department failed to highlight the total number of people who applied for social grants. And then we have a backlog on foster care grant beneficiaries. So people who qualify to benefit here are not benefiting, are still waiting. Moving on to the right to education. And no evidence, information or statistics are provided by the DBE support the commitment made in the DBE strategic plan, such as improving school infrastructure, providing high quality support and material for learners. Teachers facilitate the increase in the supply of qualified teachers, teach new subjects that adequately prepare learners for changing world. We're moving on to the last two rights, which is right to environment and right to food. For the right to environment, we could not, there was no relevant information to use. And then for right to food, there was no response, despite numerous repeated efforts by the SAHRC. So the environmental affairs did submit, but the information was not relevant. It was not what we requested for, based on the questionnaire submitted to them. And then the recommendations Our report contains recommendations that are intended to strengthen the 7 rights mentioned earlier. Examples included the right to adequate housing. Department of Human Settlement must urgently implement targeted reforms to accelerate housing delivery, improve governance, and expand financial access for those in need. The housing finance model must be restructured to support the gap market. Strengthen accountability mechanism in housing budget allocation to prevent the underutilization of funds. To healthcare, DOH must strengthen the budget allocation and financial management, expand and retain the healthcare workforce, improve healthcare infrastructure and resources availability, enhance service delivery efficiency and equity, address legal and accountability challenges. Moving on to DWS, develop clear plans for the engagement of communities affected by the delivery backlogs, implement its strategy to address the challenges identified by the DWS, and then moving on to DSD, right to social security. DSD need to collect more accurate, aggregated, and comprehensive data across all categories of state revenue-funded social assistance programs. The eligibility criteria for targeted group under social assistance pillar need reform to improve inclusivity and efficiency. DSD must develop strategic policies and legislation that clearly outline rights and obligations. We're moving on to DOE. So DBE, thank you. DBE needs to implement stronger policies. Urgent measures are required to address geographical disparities in the provision of basic education. We all know we still live unequal as a community, as South African. Like schools in rural areas do not receive same resources as those in big towns or in big cities. And then the DBE must regularly consult with the disability sectors for inclusivity purposes. Ensure minimal level of infrastructure is provided to all schools. In conclusion, the response rate was 71% for this reporting period. Section 184.3 requires 100% compliance every year. Many challenges still remain. Many policies and systems in place, but implementation is inadequate. Non-responsive or providing unusable information is contrary to the spirit of Section 184.3. Thank you. Nakenza.
Thank you to Ms. Mahori, who's the researcher. I'll then ask Mr. Alan Tumbo, the senior researcher, to give insights into the recommendations of the monitoring report. Thank you.
Let's go, cheers.
Okay, good afternoon, everybody. I believe all of the acknowledgements have already been made, so I'll dispense quickly with the presentation. My name is Alan Tumbo. I'm the Senior Researcher for Equality here at the Human Rights Commission. I'm going to be presenting on our Monitoring of Recommendations report, and I'll speak briefly about what that is about and go into detail on the areas in which we monitored this year as an institution. Just briefly, the contents of my presentation will cover the background, our observations when we conducted monitoring of healthcare facilities, infrastructure in schools, the national elections in 2024, and then I'll briefly cover the provincial specific monitoring that was done. Just briefly, this report has information that comes out of the 2024 financial year, 2024-25, which ended in March of 2025. And we had outlined 3 particular areas that we wanted to monitor during the financial year. That included election monitoring or observations. Secondly, looking at the minimum standards of school infrastructure through various schools that we inspected. And then covering healthcare facilities, more particularly in terms of waiting times and the impact of electricity or lack of in healthcare facilities. Other provinces also, or all of our provinces also identified previous reports that the Commission has published that had recommendations made, and they also monitored the recommendations and the implementation thereof. Just briefly to speak of the methodology that we have used as an institution to monitor, and this applies both to this report and the State of Human Rights report. We conducted in-person visits to all of the institutions that we had identified both previously and in this report. And basically, we had provided monitoring tools and forms for all of our monitors to use on the ground when monitoring. This includes commissioners, this includes all staff that are involved in the monitoring process. And primarily the monitoring forms allowed monitors to identify whether human rights norms are being observed on the ground and being complied with by the respective institutions. Some of them are digitized, particularly when it comes to elections. We use digitized forms so that we could produce a report in a timely fashion. We had managed to finalize our elections report in 60 days and supply the IEC with the report. So I'm going to go into the 3 areas that we monitored quickly. It has already been mentioned that we monitored 367 schools in all provinces, which makes up about 41 per province. I know this is a small sample because we do have about 20,000 schools in the country or over, but it does give us an indication of what's happening in the areas that we monitored. The primary regulation that we were focusing on was the regulation on minimum uniform norms and standard for public school infrastructure, which was published in May of 2024. In terms of the sample or the different types, sizes of schools that we had monitored, the majority when it comes to primary schools were mega schools, which have 930 learners and above, followed by micro schools, which made 6% of schools visited. In terms of secondary schools, we went to mega schools, which are 1,000 learners and above. They accounted for 29%, followed by large schools, 600 learners to 1,000, which accounted for 25% of the schools we monitored. This table over here just gives you an overview of each province, our provincial offices, and the amount of schools they monitored. Once again, you can see the Northwest really leading us in terms of monitoring with 100 schools monitored in that province. In terms of monitoring outcomes, we had sought fit to include teacher-to-learner ratios, even though they do not make part of the regulations that I had mentioned earlier. We thought that since we're going to be at schools, let's also get a further understanding of what's happening on the ground. And we found that on average, for 31 learners in public schools, there was 1 teacher. This was the highest in the KwaZulu-Natal province with 39 learners to 1 teacher. And in contrast, it was lowest in the Western Cape with 28 learners to 1 teacher. This table just gives you an overview of that, so I'll move straight along. We had also now looked at the issue of water supply, electricity, and sanitation. I've briefly mentioned what the regulations say in this respect, but interesting to note would be that these regulations are supposed to be complied with within 18 months of the publication of the regulations, which would basically be December of this year, meaning there's about 2 or 3 months left for compliance with these regulations. So when you look at electricity supply, for example, it requires that every school should have some form of power supply that is sufficient to the power requirements of the school. What we found, what you can see in this table, on the left side we have the access to electricity in each school. On the right side we have the level of backup electricity access in each school. So you can see that on average 97% of schools had access to electricity, and it was only in several, maybe 3 or 4 provinces where it wasn't 100% of the schools having access to electricity. However, if you look at the access to backup electricity, so what happens when there's load shedding, we found that on average 30% of schools had some kind of backup so that they were able to function during load shedding. You can see that, for example, in KZN there weren't any that were found that had access to backup. And that's also followed by Mpumalanga with 13% and Western Cape with 15%. When it comes to water supply in schools, again, the regulations provide that each school should always have water which is available and acceptable for drinking, personal hygiene, and food preparation. There are other areas that we monitored, but I won't cover them here today. They are contained in the report. In the table on the left side, you have the percentage of schools with water supply. The total average in the country was 97%, but was particularly lower in KZN and in the Limpopo province. When you look on the right side, you will see we had asked if the water was acceptable for drinking and cooking and for hygiene purposes. And you can see that 92% of schools had acceptable water, but again, it was lower in the Eastern Cape, the Free State, where we found several schools that had water that was not acceptable for use for drinking and preparation of food. Looking at sanitation in schools, the regulation requires that each school should have enough sanitation facility, but as we know, the regulation also prohibits the use of plain pit toilets or bucket latrines, basically what we have seen having an impacting the life of students in school in the last few years. In terms of our outcomes, what we found was that 75% of schools had waterborne flushing toilets, with 16% of schools using pit latrines. This was predominantly in KZN, with Eastern Cape also featuring quite high in that respect. 5% of schools had composting toilets. So what you see before you now is a combination of key developmental and educational outcomes that we monitor that are also part of the norms. So that includes an access to a library, where we found that 53% of schools had a library or media center. And this is just access. We're not talking about just a library physically in the school. We're looking at whether they had some form of books that the children can use to study, either through a mobile or through a class or a full-on library. When it comes to science labs, we know that as a country we're lagging behind in terms of science capabilities of our students. And you can see that 41% of schools had science labs, many of which did have science labs, but were not actually functional. So 60% of schools did not have a functioning science lab, and you can see that the impact that it's having on our development as South Africans. When it comes to electronic connectivity, this was asking if you have access to Wi-Fi in your school. 80% of schools had electronic connectivity, so the vast majority had access to connectivity, but if you look at it in contrast to access to a computer, we found that only 45% of schools had a computer. So obviously you're seeing that students are unable to access information in a way that they can actually use it and process it in a way. I think using a cell phone is not always the best way to study complex information. Just looking on sports and recreational facilities, we found that 63% of schools had sports and recreational facilities. Okay, just briefly on the issue of universal design, the regulations contain a definition of universal design that includes being inclusive of persons with disabilities, both staff and students, learners. But also, it is a broad definition that includes every person. So, for example, you'd know that the Commission has done investigations on the inclusion of transgender persons in schools. That would fall under the overall definition of what universal design would mean. But we did find that 70% of schools had universal design or met the requirements of universal design. So I'm going to move on briefly to monitoring of healthcare facilities. It had already been mentioned that we had monitored 219 healthcare facilities in the country, with our Mpumalanga province monitoring the most, with 21% of the monitoring done. In terms of the types of facilities we monitored, primary healthcare clinics were the highest, obviously, with 92% of the facilities that we monitored, followed by district hospitals. We had, as I mentioned earlier, we had monitored a wide range of issues, including waiting times and the impact of load shedding. So in the next bit, I'm going to cover the issues that are critical and have an impact to waiting times. So that includes the average staff complement. We found the average PHC had 33 staff per facility, the highest being in Mpumalanga. And I must say that Mpumalanga performed very well in a lot of the healthcare related indices. When it came to Eastern Cape, they had the lower of the averages with 23 staff per facility. We asked when we went to an institution, we asked all of the staff what their views were on whether the demand for healthcare exceeded the capacity that they had at the hospital, at the facility. And 60%, 67% of staff were of the view that the demand exceeded the capacity across the country. The most understaffed in this sense was the Free State province, where 94% of staff indicated that the demand exceeded the capacity. In contrast, Mpumalanga was the only province where the staff felt that the capacity exceeded the demand. That was 64% of staff. In terms of waiting times altogether, we were monitoring the national guideline which speaks to the management of patient waiting time in clinics and other forms of healthcare facilities. I won't go too deep into that, but what you can see is that the maximum patient waiting time for services should be 120 minutes across the various institutions and facilities. What we found is on a national level, the average waiting time observed was 129 minutes per person, which is just over 2 hours. This was highest in Gauteng, quite surprisingly, at least for me, with 195 minutes, which is just over 3 hours per person. In contrast, we had seen other provinces like Northwest having very low waiting times of 67 minutes. But in general, we found that across the country on average, the waiting time exceeded the prescribed maximum. This just gives you an overall indication of that. Yes, so I'll move on briefly. We then looked at access to electricity in healthcare facilities and found that 98% of facilities had access to electricity. However, when looking again at backup capabilities, we found that only 49% of facilities had measures in place. And I think this is critical compared to education, because in the healthcare sector, not having access to electricity has a huge impact on the access to healthcare. There are several different types of machinery that require electricity to be operated. Everything from freezing to different operations that can be done. So we found Free State to have the lowest levels of alternative power supply, followed by Eastern Cape and Northern Cape. Yes, so this table basically just gives you both indices next to each other and is going downwards with access to backup power. Okay, so I'm going to move lastly when it comes to 3 items on our elections observations, and given that we're moving to a local election year, perhaps it will help to rehash some of the things that we had observed as an institution. Just to give you an overview of what a human rights institution would be observing during an election period, it's a combination of civil and political rights, such as the right to vote, the right to safety and security and privacy, equality and non-discrimination rights, such as the inclusion and of women, more particularly pregnant women, the inclusion of persons with disabilities and older persons. And then we had also looked at additional principles. I will not go too deeply into them, but this included the handling of ballot boxes, the inking of voters' thumbs, professionalism, adequate sanitation, and connectivity, amongst others. Just to give you an indication of the staff commitment that we had on our side, a total of 60 human rights staff, Human Rights Commission staff, including commissioners and staff, were all accredited to do observations during the elections, which included executive, provincial, and national staff. We had also called on our human rights champions that are basically human rights defenders throughout the country that were not accredited but work deeply in communities and are able to give us information on the status of human rights observations in communities, and they made 118 submissions to the Commission on what they observed during elections as well. This gives you an indication of the 165 responses that we had, with Gauteng being the highest, obviously with 46, with a lot of us at national office being involved in the monitoring. Okay, so just to go through some of our observations, 99% ballot box assembly, we found that they were correctly assembled, 97% in terms of inking of thumbs, so nothing that we found that we felt brought that in disrepute in any form. And then the majority felt that, 98% felt that the IEC staff were professional during the elections. I think one of the more concerning of the observations was access to sanitation facilities, with 82% of observers indicating that there was safe, provided clean, accessible restrooms. Of course, we know that connectivity was an issue during the elections, with 70% of observers reporting that voting stations experienced connectivity problems, and we know this created a lot of delays during the elections. I'm just going to go over the security incidents. We did not observe any significant security incidents, and those that were observed related more to the delays during elections. When it comes to privacy, again, there was a general understanding that privacy was observed, but with I will add that this was not the same when it comes to persons with disabilities, and I'll speak to that when I get there, which is now. We had measured the physical accessibility of voting stations. Some of them were schools, some of them were different ranges of institutions and buildings that were used. It was found that 6.7 out of 10 institutions were found to be physically accessible. But it should be noted that 12% of all of the institutions monitored were rated as a 1 out of 10 for accessibility, meaning there's huge concerns for the access of persons with disabilities to these buildings. This was particularly prevalent in Limpopo Province, Northwest and Eastern Cape. So I just briefly want to speak about the issue of voting independently and privacy for persons with disabilities. We found that the system used did not allow persons with disabilities to vote independently on an equal basis with others. So you know that when you go and vote, you can have your own booth and you don't need to tell anyone your vote is your own. Whereas for a person with a disability, they needed to depend on another person. They needed to tell the other person what their vote would be, and that person would fill it in for them, which doesn't meet the requirement of the Convention on the Rights of Persons with Disabilities when it comes to the right to privacy and to vote independently. In terms of older persons, briefly, we just found that older persons, when they went for special voting, were often sent away if they had not registered at that voting station, and we felt that it should be a standard practice that older persons be allowed to vote even regardless of registration during special voting days. Yes, so in terms of pregnant persons, we did not find any concerning matters in that respect. And then we did obviously publish a statement indicating that we found that the voting in elections was overall free and fair, and nothing was observed that undermined or disenfranchised voters. Okay, this is the recommendations that we made overall. This included improving sanitation facilities, addressing connectivity issues, dealing with the issues of privacy for persons with disabilities, and as I mentioned, the concerns with older persons. This report, as mentioned, was already submitted to the IEC. Okay, then lastly, I will just quickly go through what was monitored by provinces in relation to previous report recommendations that the Commission had made. I will not go into detail of what was found and what was done in those activities. You can find that in our recommendations monitoring report. But you can see that the mental health care hearing report, which was conducted in 2019, continues to be a big part of the monitoring the Commission does across the country. We go to psychiatric facilities and mental health care facilities, and this was one that the Free State, Northern Cape and Limpopo took on during this financial year, in addition to others. In Eastern Cape, we had the malnutrition report featuring very well. And then you can see for a few provinces, I won't go one by one, the issue of sewage, pollution, access to water remains a huge problem in the country, and there's a lot of monitoring work being done in that respect. Lastly, we have the issue of the state of service delivery in Mpumalanga, also with sewage, and then obviously the very pertinent issue of the rights of the Khoi and San in South Africa, which is being monitored in the Northern Cape province. Yes, so I think I will end there. Thank you so much.
Thank you so much to Mr. Tumbo. Our final presentation will be from Ms. Fadla Adams, which is a senior researcher. She'll be reflecting on the international and regional human rights reports. Thank you. She is online.
Good afternoon. Thank you, Program Director, and everyone in attendance. I'm just going to flight my screen and you give me confirmation that you can indeed see it and that you can hear me clearly. Madam Program Director, can you?
Loud and clear.
Perfect. Thank you so much. Right, let's jump straight into it. And you can see my screen, right?
Yes, we can see your screen better.
Great, thank you so much. Okay, let's jump straight into it. I am quite mindful of time, and I know that I only have a 15-minute slot, and it's a lot to get through. As mentioned, I'm Fadla Adams. I'm an admitted advocate and senior researcher in Parliamentary and International Affairs Division at the South African Human Rights Commission. And just to give you some background into the nature of this particular report, which is the International Regional Human Rights Report of the Commission, which we publish every year, or have been for at least the last decade or so. It is more of a developmental report, and I think I need to set that out from the beginning, is that it looks at key developments that have happened at the international level, and particularly how South Africa, as a state, has engaged with those mechanisms. Of course, we are limited in terms of the extent to which we can look at the developments. Otherwise, we'd be quite I think, a thesis every year, PhD, every year that we'd be developing, because there's so much to say. So it's really just a snapshot of the key issues that have emanated that relate squarely to human rights, and particularly the type of work that we do within the South African Human Rights Commission. So I'm going to whiz through it in terms of our mandate, which is entrenched constitutionally, statutorily, and then at the international and regional level, where we have added mandate to monitor and to play this interlocutor role between the state as the recognized national human rights institution of South Africa. We are governed by this in terms of Section 13B of our Human Rights Commission Act, our enabling legislation, and through our interpretation of that provisions, we developed the International and Regional Human Rights Report, which addresses, and I'm going to stress this, a calendar year in review. And I re-emphasize emanating or highlighting selected developments which emanate from the human rights mechanisms. That's at the UN level and African Commission level in particular. So just the year that was, looking back at 2024, albeit that we're in September already, but it's always good to look back and reflect on what was the key issues that came out. And we did see that it was the 60th anniversary of the Sahrc, so that's the International Convention on the Elimination of Racial Discrimination. It was also the 35th anniversary of the UN Convention of the Rights of the Child, which remains the most widely ratified human rights treaty. And then on the regional level, we saw, very proudly so, the Protocol on the Rights of Persons with Disability and the Protocol on the Rights of Older Persons, which came into force during 2024. I will touch on this a little bit later when we get to that section. And then, of course, the inaugural session, which was a joint forum of special mechanisms at the African Commission level, which sought to foster collaboration amongst various stakeholders in Africa. Again, we'll come to that in a bit as we address the regional section of the presentation. So jumping straight into the treaty bodies, and I would encourage those interested to really look at the report. I am unfortunately unable to get into the nitty-gritty and all the modalities of the treaty bodies and how each of them operate, but it's kind of touched on in the report. But just very generally, during 2024, we saw 3 treaty bodies issuing general comments, and that was the Committee on the Elimination of Racial Discrimination, we had CEDAW, the Committee rather on the Elimination of All Forms of Discrimination Against Women. And then whilst not strictly a treaty body, some would argue that it's not strictly one, it's like a sub-treaty body, we had the Subcommittee on the Prevention of Torture, also issuing a general comment, of which our chairperson is one of the members of that committee. Very proud of that. The third issued its comment relating to racial discrimination on the right of the enjoyment on the right to health. Very interesting in light of what my colleague has just raised around primary health care facilities as well in South Africa. There's quite a lot of linkages there. We saw the committee, or the CEDAW committee, adopting General Recommendation 40 on equal and inclusive representation of women in decision-making systems. And then, of course, the first general comment of the Subcommittee on the Prevention of Torture, which related specifically to Article 4 of the Optional Protocol to the Convention Against Torture, OPCAT. And it really sought to look at how do we understand places that are defined as deprivation of liberty. Directly to South Africa and the treaty bodies, and I think that we did see a lot more developments in the 2023 cycle, but in 2024, and I've highlighted it in blue for ease of reference, we saw the South African government appearing before the Committee on the Rights of the Child, quite a delegation in attendance, and was quite a very engaging, consultative interaction between the treaty body as well as the government delegation. But going straight to the concluding observations, which were then issued by the committee after all the necessary engagements with the state, I specifically highlight that we saw the committee pointing out urgent measures which must be taken regarding children and non-discrimination, corporal punishment, abuse and neglect, including sexual exploitation and abuse, children with disabilities, health, and then of course education. Those were the specific issues which they highlighted. Of course, then they also touched on a lot more of the general issues, which I would encourage once again stakeholders to please look at the report or go directly to the concluding observations, which is linked in the report as well. South African government also submitted its follow-up information regarding its fifth report under the Convention on the Elimination of All Forms of Discrimination Against Women. So this was a report which was submitted in 2021, and the state went through the necessary review process for the treaty body. At the time, the CEDAW committee asked for the government to come back with, to provide information on specific issues, and those are listed below. So related to training for law enforcement and the judiciary, implementing systemic training or rather systematic training for judges and prosecutors, etc., around gender-sensitive procedures, addressing stigma, stereotypes, bias, and of course encouraging reporting by victims. On that also, what the state has done so far as victim support services, providing safe houses and shelters, especially in the rural and remote areas, and then a coordination mechanism which came through quite strongly as well. I mean, I think if one looks back at the 2021 engagement between the state and the treaty body at the time, we did see that there was a lot of questions around the establishment of a standing interministerial committee to coordinate women's rights reporting and to monitor the implementation of CEDAW recommendations. And we have the state provide follow-up information in this regard as well. And then, of course, the criminalization of harmful practices. Ukutwala is very much raised whenever we appear before the treaty bodies, and often I do notice that the state really tries to explain the nuances around it and the laws that are currently in place. But I saw that in this instance, once again, we had to, or the state had to provide information in this regard, and particularly in relation to prosecuting and providing victim support. Sorry for the frog in my throat. Also, the Human Rights Committee, which falls under the International Covenant on Civil and Political Rights, issued its list of issues prior to reporting to South Africa. And just for those who may be aware, this forms part of the simplified reporting procedures which the UN treaty bodies have now rolled out, given how arduous the process was before. So under the new simplified reporting procedures, we see that there's a list of issues prior to reporting which is submitted. And in this instance, the UN the Human Rights Committee requested South Africa to provide updates on the 2016 concluding observations which it issued to the state, noting it had not reported since. It also asked for information around thematic issues in 24 human rights areas, which I've listed, as well as for the state to provide information on the South African Human Rights Commission and the clear mandate given to us to monitor places of detention or other places of deprivation of liberty, and of course efforts taken by the state to ensure that we receive adequate funding to expand our national footprint. On that note, also to mention that we do, by virtue of our NHRI, National Human Rights Institution status, we submitted a list of issues prior to reporting the report. NHRI 1, which is kind of a parallel report, we also did one in response or in dovetailing rather with the state's submission as well, or rather what they prior to the state submission, just for information to help inform the committee in developing their questions to the state. South Africa's official response to the list of issues is prior to reporting is due at the end of this year. We keep our fingers crossed that they will indeed meet the deadline. And then I think something we're quite proud of at the Commission front, and it would be remiss of me not to mention this, is that whilst not a treaty body per se, but something which is quite notable is that the South African Human Rights Commission appeared for its reaccreditation before the Global Alliance on National Human Rights Institutions Subcommittee on Accreditation. And this is the body which assesses national human rights institutions throughout the world for their compliance with the Paris Principles, which is the instrument which provides the mandate and the working methodologies and so on, or at least not all the working methodologies, just some ideas. function effectively and independently and, of course, impartially. The Commission submitted a detailed report in advance of its appearance before the Gandhi Subcommittee and detailed our mandate, our diversity of inclusionism within and among staff and commissioners, the appointment processes at staff level and commissioner level, funding, and of course the extent of our institutional independence from the state. There was also civil society inputs which were provided and UN body inputs which were provided to the committee. And after a thorough review process, we're very proud that we indeed received our A status accreditation and that we were commended for promoting and protecting human rights in South Africa and the nature of the work that we do and the quality as well as the type of reports which are produced by the Commission. So they were quite impressed with that. At the Human Rights Council level, I'm looking at the time, 4 minutes left, so I'm going to have to jump. 4 minutes, 18 seconds, 16 seconds now. During 2024, we did see the Human Rights Council holding 3 regular sessions, the 55th, 56th, and 57th. 97 texts were adopted for the year, and approximately 56% of those texts adopted by the Council were thematic in nature. In other words, it related to the promotion and protection of human rights, civil, political, economic, and so on, including the right to development. We also saw that out of these texts adopted, 71 resolutions and 3 decisions gave rise to resource requirements, which means that it required that funds be made available in order to give effect to what that resolution sought to achieve. In January 2024, and this was reported on briefly in last year's International Regional Report as well, South Africa during 2023 submitted its candidacy to as a presidency for the Human Rights Council for the 2024 term. In January 2024, unfortunately, we lost out, or South Africa lost out to Morocco. It was a rare secret ballot amongst member states, and Morocco achieved the higher number of votes and was subsequently appointed to hold the presidency for 2024. We also saw at the state level, at least, as South African government's interaction with the Human Rights Council, that we participated in a high-level segment of the Human Rights Council during the 55th session. And we co-sponsored, or rather the state co-sponsored 3 resolutions. I'm just going to dart off for a second and mention that during that high-level segment, we were represented by the former Minister of International Relations and Cooperation, and she very strongly spoke about the need for, or concerns around the polarization among states within the Council, the double standards relating, and I'm speaking off the top of my head from my recollection, the double standards relating to human rights matters within the Council and among states. I think this is very important for us to be mindful of. And then, of course, touching on the conflict in Gaza and reiterated South Africa's call for a ceasefire in this regard. This was mentioned at the Council level again. On the resolution front, the state co-sponsored 3 resolutions, one on combating discrimination, violence and harmful practices against intersex persons, another one on education as a tool to prevent racism, racial discrimination and related intolerance, and then of course the resolution on good governance, the promotion and protection of human rights. In fact, that one also touches on corruption. At the African regional level, with 1 minute 43 seconds to go, we saw 5 voting sessions being held, 4 of which were public. If I'm not mistaken, I think it was 3, or maybe it was 4. During 2024, also a new